Welcome to Lesson 10 of the Neonatal Resuscitation Program, focusing on special considerations in neonatal resuscitation. This module, presented by Dr. Salem Keshba, covers the advanced management of complex newborn presentations. Our learning objectives for this video include managing abnormal air and fluid collections, like pneumothorax and ascites. We will also cover managing airway obstructions, congenital lung abnormalities, respiratory depression due to maternal drug exposure, and the care for newborns with neural tube and abdominal wall defects. Section 1 covers abnormal air and fluid collections, specifically pneumothorax, pleural effusion, and ascites. Pneumothorax is air in the pleural space, often linked to assisted ventilation. Clinical signs include decreased breath sounds and bradycardia. Tension pneumothorax is a life-threatening emergency, causing sudden respiratory distress or failure to improve with resuscitation. Diagnosis often involves transillumination or a definitive chest X-ray. This scene illustrates the proper locations for needle insertion during percutaneous aspiration of a pneumothorax or pleural effusion. Note the specific intercostal spaces for each procedure and the proper positioning of the infant. Pleural effusion is fluid surrounding the lung, and ascites is fluid in the abdominal space. Both can cause respiratory distress. Large pleural effusions require needle aspiration. Large volume ascites may require catheter insertion and emergency drainage after birth. Thoracentesis is a step-by-step procedure starting with a timeout and sterile technique. Positioning varies based on the condition being treated. Preparation includes topical antiseptic. The procedure involves inserting a catheter over needle, aspirating the air or fluid, and monitoring the patient's condition. A post-procedure radiograph is necessary. Section 2 focuses on managing airway obstruction, covering thick secretions, Robin sequence, and choanal atresia. For thick secretions, suction through the endotracheal tube may be needed. For Robin sequence, position the infant prone or insert an NP tube if necessary. Choanal atresia, a nasal airway block, requires immediate ETT insertion as a bridge. Always test by attempting to pass a suction catheter through the nares. Section 3 addresses congenital lung abnormalities, specifically diaphragmatic hernia and pulmonary hypoplasia. Congenital diaphragmatic hernia, or CDH, is where abdominal organs enter the chest, leading to pulmonary hypoplasia. Key management steps include prompt intubation and continuous gastric suction. Crucially, avoid face mask ventilation. Birth should occur at a high-risk center. Section 4 covers respiratory depression at birth, including opiate and anesthetic exposure and the use of naloxone. Opiates decrease the newborn's respiratory drive. Other causes include magnesium and anesthesia. The priority is providing airway support and positive pressure ventilation until breathing resumes. Naloxone use has insufficient evidence for safety in newborns, and ventilation remains the focus. Section 5 discusses neural tube and abdominal wall defects, covering myelomeningocele, gastroschisis, and omphalocele. Myelomeningocele is a neural tube defect. Key care involves preparing a foam ring for positioning and using latex-free equipment due to high allergy risk. Always prioritize airway, breathing, and circulation. Do not delay resuscitation steps. We now compare gastroschisis and omphalocele, two abdominal wall defects. Gastroschisis is when the bowel protrudes to the right of the umbilicus, with no covering sac. Omphalocele involves the umbilical cord and has a membranous sac covering the organs, often associated with other anomalies. Shared management involves placing the exposed bowel in a sterile bag, positioning the infant on the right side, and inserting a large orogastric tube for suction to prevent bowel distension. These key clinical points summarize Lesson 10. Remember to suspect pneumothorax if resuscitation fails and avoid face mask ventilation if CDH is suspected. Prioritize ventilation in maternal opiate exposure and use latex-free equipment for myelomeningocele. For abdominal wall defects, protect the exposed bowel and insert an NG tube for suction. Review the target preductal SpO2 table and consider the review questions, focusing on applying the knowledge from this lesson regarding advanced management scenarios. The questions cover pneumothorax management, airway obstruction interventions, opiate exposure priority, and avoiding improper ventilation with CDH. Thank you for reviewing Lesson 10 of the Neonatal Resuscitation Program, Special Considerations in Neonatal Resuscitation.